Hello viewers, how did your week go? I know you'll be playing safe. Even though the coronavirus seems to be going as you may be thinking, it is not actually gone. So there is need for us to remain safe. What are we discussing today? We are still discussing around our mothers, our wives, and our daughters. This time we want to talk about why they should actually register their pregnancies in a health center, in a health facility. And we are going to tailor it towards the kind of investigations or tests that they would benefit from as they register their pregnancy. Now, when you visit a health center, irrespective of how many times you've been pregnant, whether you've been pregnant for the 4th time, the 3rd, the 2nd, or the 1st one, these investigations will be repeated. And I want to briefly talk about them and then tell you how important they could be. Let's take the very basic one, your volume, the blood volume, called packed cell volume, PCV. Now, this will help you to know that your baby is well nourished, you are healthy, because there is a certain level of blood you should have. During pregnancy, it is your blood that carries nutrients to the baby that is in your uterus. So if your blood volume is down, the doctor wants to do something about it. So you don't want to wait until the blood level is actually down. How do you know this? It is only when you go to the health center that they will check your blood volume. After that, they will ask you for your urine. They are going to do urinalysis to know, do you have infection? But if you have infection, this can affect your baby. They're also going to find out your sugar level. If it is too high, it is not good for your baby. Then they will find out if you have hepatitis B, hepatitis C, and syphilis. It is from blood they will be able to discover if you have these diseases, because these things can affect your baby. Take, for instance, the Venereal Disease Research Laboratory. Now, that investigation is targeted at syphilis particularly, and if a woman has syphilis that is not attended to, the likelihood of having a baby that is going to be deaf, blind is very high. But if it is discovered during antenatal early enough, treatment will be administered and these complications can be avoided so you can have a very healthy baby. Other investigations that you need to know while you attend the antenatal or while you register with a health center is your blood group and your genotype. If you have a rhesus factor, for instance, that is negative and your baby is positive and you are going to have a second baby and you were not treated in your first baby, there are likely going to be complications. So when you attend antenatal, you will have the benefits of having these blood investigations done for you, and a lot of complications can be avoided in your index pregnancy, that very pregnancy and subsequent pregnancies that you are going to have. Then your subsequent visits in the antenatal clinic, you are going to have your urine being tested, and if necessary, other investigations that may be requested for. In some rare cases, they may ask you for rubella and other viral illnesses that could affect your baby. These illnesses can cross the placenta to your baby and will cause complications. So we cannot overemphasize the need for you to book in a health center, or what you can afford, what is affordable to you, or what's accessible to you rather, that a lot of complications can be avoided. You have a healthy baby and you yourself as the mother of that baby will be healthy. So we advise that you book your pregnancy as early as possible. This is our aim, to always enlighten you and let you know the right thing to do when it comes to your health. I remain Dr. Clement, the one always interested in your health, because your health is a priority to us. Our business is to enlighten you. Till the next episode, please remain safe.